Today I will be performing a neurological assessment. I have introduced myself to my patient and I have identified my patient with two identifiers. My patient is oriented ×4 to person, place, time, and date. I've performed my hand hygiene. I've provided for privacy, and I have explained my procedure, and I am wearing my gloves. My patient's abstract thinking is relevant. Her attention span is accurate. Her comprehension, she's able to follow instructions. Her general knowledge is accurate. Her judgment is intact. Her memory is intact. Her vocabulary is expected for her age and her education level. And I did not notice any problems with her pronunciation, so her articulation is also good. So we're going to begin with the CN1, which is her olfactory, and of course we all know that means smell. And so I'm going to sit at eye level with my patient, and she's already cleared her nose before we started. Can you occlude one nostril for me? Okay, can you close your eyes? Smell? Can you identify that smell?
That's coffee.
You are right. Can you occlude the other side of your nose and smell?
It's a candle.
Can you?
Vanilla.
Yeah, it is vanilla. So she correctly identified those scents. So we're going to go ahead, and there's a Snellen chart on this wall, and she's 20 feet from it, and she's read the part that identifies that she's 20 feet away and that she has 20/20 vision. Can you read this for me at 14 inches? You can just pretend.
Use ophthalmoscope to view retina and disc and optic disc.
Okay, so her visual field, the patient reads print at 14 inches without difficulty. So now we're going to go ahead and test her visual fields. I'm going to be eye level with my patient, and I'm going to cover her eyes covered. And can you tell me when you see my hand in your peripheral?
Yeah, now.
Okay.
Now.
I think I did that wrong. Okay. So her visual fields are good. And so I'm going to use my ophthalmoscope, and I'm going to view her retina and her optic disc. Okay, so they're round and the reflex is present, and it's at 1.5 millimeters. Her margins are well defined. There's a creamy pink with polar physiologic cup, and the retina is pink. Okay, so now we're going to go on to the CN3 oculomotor, and the 4, which is the trochlear, and the 6, which is the abductans. So I'm going to inspect the margins of each eyelid. Okay, and they cover about 2 millimeters of the iris. So we're going to go ahead and do extraocular movement to see if she has that. Can you follow my ophthalmoscope? Okay, so there's not any extraocular movement. They were smooth and coordinated. So let's do her pupillary response to light with direct and indirect light. Can you open it? Okay. Okay, so they are bilaterally illuminated pupils. They constrict simultaneously, and the pupil opposite to the one illuminated constricts simultaneously. So now her CN5 is her how do you say that? Trigeminal. And so that's going to test her motor function. So can you clench your teeth for me? Oh wait, I'm supposed to be palpating. Okay. And clench your teeth again. All right. They contract bilaterally. Okay, now we're going to do sensory. So I'm going to ask her to close her eyes again, and I'm going to touch her with a dull and a sharp edge of a paper clip, and she's going to tell me where I touched her. And was it the dull edge or the sharp edge? So where am I touching you?
On my forehead,
All right.
my cheek,
And what was it? Is this sharp or dull?
dull. Dull.
Okay. Where am I touching you now?
My cheek,
Is it sharp or dull?
dull.
That's right. Okay. Now we're going to use something soft. Okay. Actually, I shouldn't tell her I'm going to use something soft. I'm going to start over. Okay.
Dull.
Okay.
Soft.
Okay. Very good. She correctly identifies sharp, dull stimuli with light touch to the forehead, cheek, and chin. So, can you look away and up? I'm going to lightly touch her, which I'm really not, with a wisp of cotton in her eye. Okay. They blink bilaterally. So her CN8 is her facial motor function. So can you smile? Can you frown and wrinkle your forehead? Show me your teeth. Puff out your cheeks. Purse your lips. Raise an eyebrow or your eyebrows. Okay, close eyes. Close eyes tightly. I guess, okay. She does all these things listed and they are symmetric. Okay, so cranial nerve 8. We're going to do the Ryan and Weber tests, and those are for acoustic. This is my tuning fork. So we also did this before in a previous video. So you tap it on your hand, and then put it here, and tell me if you can hear it equally in both ears. Okay, so she does. And then that was the Weber test. Now we're going to do the Ryan test, and we're going to tap it and place it on the, is that the mastoid bone?
Oh.
And then tell me when you quit hearing it,
I quit.
and then if you still hear it.
Yes.
Okay. And so we're going to do the whispered word test. I'm going to stand about 2 feet behind her, and she's going to cover one ear and repeat the sentence that I say. Can you cover your left ear?
I love going to Aggie's house.
Yes, do the other ear.
I'm glad I got to see Kagan.
Okay, very good. So she hears the whispered words from 1 to 2 feet, and the vibration was heard equally in both ears. What am I doing? I accidentally wrote on 2 cards. Okay, so the CN 9 is the glossopharyngeal, and the 10 is the vagus. So it's going to be motor function, and this is my tongue depressor, and I'm going to ask her to say ah. Uvula is soft, and the palate rises bilaterally and symmetrically. Thank you. Okay, so we're going to use this again, and I'm going to test her gag reflex. It's intact. Okay. I'm going to test her ability to swallow. Good. And her, she's able to swallow, and her voice quality is good also. No hoarseness is noted. So now we're on to cranial nerve 11, which is her spinal accessory. So, okay, can you shrug your shoulders for me? Very good. Okay, and so her trait, there is symmetrically strong and contraction of the trapeze muscles. Need to learn how to say those. Okay, can you turn your head towards my hand? Okay, good. Let's do this side. Okay. Strong contraction of the sternocleidomastoid muscle on the side opposite turned. Okay, so the CN12 is the hypoglossal, and this is to assess strength and mobility of the tongue. So I'm going to have her protrude her tongue and move it side to side against resistance with my tongue depressor. Okay. Move it from side to side on the inside. There we go. touch the inside of your cheeks. Okay, I guess we can do it. Her movement is symmetric and smooth, and bilateral strength is apparent. Okay, so when she came in, I assessed all the condition and movement of her muscles and the size and the symmetry when she came into the clinic today and walked back to the room. Her muscles are fully developed and symmetric in size. Also did an assessment of them. So now we're going to go through the range of motion, which she walked in and I could see that she had full range of motion. So, okay. When she's relaxed, her muscles contract voluntarily, and she shows mild, smooth resistance to passive. All muscle groups equally strong and against resistance. So she didn't have any unusual or involuntary movements. She didn't have any tics or tremors that were noted. She's good there. And her gait and her balance, when she walked across the room, she had freedom of movement, symmetry, rhythm, and balance. Her gait is steady, and her arms are opposite when she swings and when she walks. Okay. So, the heel to toe walk. Would you like to stand up and do the heel to toe walk? We're just going to walk across the room, heel to toe. Just go ahead and do that. Okay, that's good. So you would want to stand close to them, especially if they were older, in case they lost their balance. But she maintained her balance with tandem walking, and she walks on her heels and toes with little difficulty. Okay, so the Romberg test is another balance test, and that's where the patient stands with their eyes closed. And how many seconds was that? Go ahead and do it.
20.
This is another one where you want to provide for safety, especially with your older population, or if anybody has any muscle weakness. Okay, good. She stood erect and she had minimal swaying. You should do that with her eyes opened and closed. Okay, so here's the fun one. You're going to stand on one foot and bend your knee and hop.
And hop?
Hop. Okay, do it on the other leg. Good job. She hopped on both feet without losing balance. That's another one that you want to consider not doing on some people, especially your elderly. So now put your hands out to your side and touch your nose. Okay, that's good. She touched her fingers to her nose with smooth, accurate movement and little hesitation. Okay, so we're going to touch each finger to our thumb. Okay, she did that rapidly. So put both of your palms on both of your legs and turn your hands up and down rapidly. Okay. She was able to do that rapidly. Okay, so this is the heel to shin test. If you will take your right foot and rub your heel down your shin of your left leg. Okay, good. Can you do it the other way? She's able to run each heel smoothly down each shin. Thank you, Miss Kagan. Okay, so we're going to assess light touch, pain, and temperature sensations. You're going to close your eyes, and we've already done this one. Okay, we're going to skip that one because we did it already. Okay, so I'm going to strike the tuning fork and place it on the distal. Okay, this one goes on your arm actually. And I'm going to place this one on your distal radius, which will be about right here. And I'll put my forefinger on it. Where's the medial malleus? Oh, that's for the toe. Okay. Okay, so tell me if you feel this. Okay. Now I'm going to also do this on the tip of her great toe. Can you feel that? Mm-hmm. Okay, good. She correctly identified the sensation. Okay, so now I'm going to hold your, don't look at, close your eyes. Tell me if I'm pushing your finger down or up.
Down.
Okay. I'm going to do
Up.
Okay. And on her toes, I'm doing the same thing.
Down.
Okay.
Up.
Okay. She correctly identified the directions of the movements. Okay, can you close your eyes again? Mm-hmm. And I'm going to place an object in your hand, and I need you to tell me what it is.
Okay.
This is for
coin.
Tactile discrimination. I'm going to place another object in your hand.
Paperclip.
Yes, it is. She correctly identified the objects. I'm gonna touch you, and I need you to tell me where I touched you.
My hand. Shoulder. Arm. Leg. Toe.
Okay. She correctly identified the places where I touched her. Okay, now this is a long word, gravesthesia. So with the blunt object, I'm going to trace a number on the palm of her hands and see if she can tell me what that number is.
5.
Yes.
3.
Yes. And we used our tuning fork. She correctly identified the written number. Okay. So I'm going to touch her on the same area on both sides of her body and ask her to identify the areas touched.
Legs.
Yes. She correctly identified those places. So now we're going to use our reflex hammer. One side is pointed, one side is not. So I'm going to do her bicep. So you bend your arm slightly. Your palm is going to be up. And I'm going to put my thumb over your bicep tendon. And I'm going to strike my thumb with the pointed side. Ouch. Okay, so the reflex score was a 2+. And now we're going to... Her elbow flexes and contractions of bicep muscle is seen or felt at a 2+. Forearm flexes and supinates a 2+. Now her brachial radius reflex. She's going to flex her elbow, palm down or at rest on lap or abdomen. And with the flat side of the hammer, I'm going to tap the tendon radius 2 inches above the wrist. Okay. Flexion and supination of the forearm. Now her tricep reflex. She's going to hang her arm freely. I'm going to support it with my non-dominant hand. The elbow is flexed. The flat side, I'm going to tap the tendon above the, is that the ulceron process? Yes. So. That was very hyperactive.
I have hyperactive something radius.
Elbow extends in triceps contracts more than normal, which normal is 2+. Her patellar reflex is next. So both legs are going to hang freely, and with the flat side of my reflex malleus, I'm going to tap her patellar tendon. Okay. Okay. Her knee extends and her quadricep muscle contracts. The range is a 2+. Now for her Achilles tendon. So I'm going to have you dorsiflex your foot. Okay.
Oh my God,
Her shoe is off.
shoes.
Okay, her foot is dorsiflexed, and I'm going to tap the Achilles tendon with my hammer, not my hand. Okay, good. Let's do the other one. Normal range is 1+ to 3+. Okay, so her foot had plantar flexion. Okay, with the end of the hammer or tongue blade, I'm going to stroke the lateral aspect of the sole of her heel in the ball and the curve immediately across the ball. So that's better without shoes. Just saying. Her shoes are off. Okay. Flexion of toes occur. Now her abdominal reflex.
Oh, well, I ain't got no abdominals.
I'm going to lightly stroke each side of her abdomen and the umbilicus. Okay, so her shirt is off. Oh, they contract. And the umbilicus deviates toward the side being stimulated. Let me see. Oh, yep, I saw that. Okay, and that concludes our neurological assessment.